This is a video on cancer, on oncology. It's chapter 6 in your textbook, page 164. And we're going to go through kind of the whole chapter in one quick PowerPoint. So, cancer is a large group of diseases. It's it's uh, characterized by uncontrolled cell growth and spread of abnormal cells. Uh, if these if the normal cells mutate and they replicate out of control, and the original cells are epithelial, then we call it a carcinoma. If it's from muscle or connective tissue, we call it a sarcoma. Um, Other terms that are used are sometimes neoplasm, which means new growth, a malignant neoplasm, malignancy, um, just plain tumor. They all are involved. They're all names that are used almost interchangeably. Um, the statistics are staggering about cancer. Half of men and one-third of women in North America will develop some form of cancer. 1,500 people a day die from it. What's frightening is that that's only the number 2 cause of death. I'm not certain which the number 1 is, whether it's accidents or gunshot or I don't know. Every time you talk about cancers, um, they talk about the cancer having a 5-year survival rate, and that really is what percentage of people survive for 5 years after the diagnosis. So in cases of like pancreatic cancer, it's that 5-year survival rate is very low, where in cases like skin cancer, the 5-year survival is quite high. Uh, it it seems arbitrary, but nevertheless, that's what it is. So, uh, half of these diagnoses could be prevented with lifestyle changes and early screening. The etiology of it's very complex. We'll talk about it in a few moments, but it's usually some sort of genetic predisposition with an external trigger and internal trigger. But there's definitely things that can be avoided, to better your odds. Um, so skin cancer, lung cancer are really common. Breast, ovarian, prostate, colon, pancreas, you hear about them all. So so we're going to talk more than just steps in metastasis. We'll just kind of stay on this slide for a bit. But normally, normal tissue, the cells in that tissue are fairly uniform. They're about the same maturity. They're about the same um, structure and that kind of thing. So that skin cells end up looking like skin cells. Differentiation is this idea that normal cells can go undergo structural changes and they form different tissues in the body. This is supposed to be uh, the way that it works. At one point, and about the time that your mother and father were sharing the last of the bottle of wine, you were just one cell, and that cell is differentiated into all the multitudes of different types of cells that's in your body right now. This is a normal thing. In malignancies, in cancer, these this differentiation is altered, and and the cells become some strange mutated form of what they could be. Sometimes they become cells that are appropriate but not appropriate in that area. For instance, a squamous cell of the alveoli of the lungs can start to turn into a glandular cell that is a thyroid gland and start secreting thyroid hormone. Uh, that's that's a real general possibility. Sometimes these cells, as they lose their differentiation and they almost turn into these undifferentiated cells. They just reproduce these undifferentiated cells that really bear no resemblance to the tissue that they come from. Generally speaking, when uh, the less differentiated the cell is, the kind of more aggressive the tumor is, the worse the prognosis. Um, this is this is a normal process, differentiation, that becomes subverted in this pathology. Uh, Dysplasia is another type of tissue change that can happen, and this is just where the growth becomes difficult. Dysplasia. Um, it's kind of a disorganization of cells. So the cells might vary in size or shape or something like this. And this generally happens because there's some sort of a mistake being made, that mitosis is happening too early. Um, Dysplastic cells can be benign. They can be precancerous, or they can be malignant. Any of the above, right? Um, so uh, you'll hear terms like metaplasia, which is a reversible form of dysplasia, and then you get full dysplasia. Uh, so tumors are these abnormal growths of this new tissue. Uh, they don't necessarily serve a useful purpose. They are some disorganized, dysplastic, or different, undifferentiated cells. Um, we look at it as either a primary tumor, which is the original tumor. It's the tumor where these differentiation screw ups or dysplastic screw ups happen, and it's the original tumor. We The secondary tumors are when it metastasizes, when the primary tumor kind of colonizes someplace else. And so we're going to call that metastasis. Now, in every cell, there are genes, and these genes are involved with causing mitosis to happen at the right time, and they're called pro-oncogenes. Uh, Sometimes these genes screw up, and these are called oncogenes. And the gene becomes activated, and what ends up happening is that the cell where this gene becomes activated starts to grow through the life cycle too quickly, that it reaches this idea of undergoing mitosis before the cell is ready to undergo mitosis. So mistakes are made, the cells become less and less differentiated, they become more dysplastic, uh, because the cell wasn't ready to divide when it divides. Now, they think these oncogenes happen a lot, and what activates them might be an external environmental change, could be a virus, could be a bacterial infection, might be a parasite, it could be some physical carcinogen. It might just be a genetic predetermination that you inherited the oncogene. Recently, we've come up with this thing where they looking at these genes that are actually tumor suppression genes. That these are genes that actually inhibit the oncogene activation. They get in the way of it, and it stops us from having these dysplastic growths. So they're looking at different things right now. Is the problem an activation of the oncogene, or is the problem an inhibition of the tumor suppressor gene, or is it both? Uh, it's probably both to some extent. In any case, what happens is after this oncogene gets activated and the cells start to undergo mitosis very rapidly and in a very disorganized way, then what happens is you have more and more and more of these mistakes, and that's called proliferation. Now, this is kind of the first stage of the tumor. When the tumor is proliferating like that, then what ends up happening, uh, the it becomes into a distinct mass, and they call it a tumor. Um, as they're as they're doing this, they're also secreting various enzymes that help them avoid being taken out by the natural killer cells and the cytotoxic T lymphocytes, um, and this is where they start to lose their differentiation. Now, the growth is very quick, and and if it was just left to itself, the the cells wouldn't survive uh, for very long. They need to be supported, or they want to be supported. So what happens is that in the tumor, uh, enzymes are released that promote the growth of blood vessels, and blood vessels supply that tumor. So they become the dedicated blood supply. Uh, so what they do is they have chemical messengers. They command the body to build the new capillaries. Um, this makes the tumor even proliferate faster. But it also has a, another problem, right? The tumor is starting to take up space. So what it starts to do is it starts to invade the connective tissue that's surrounding it. And this is when the the cancer goes, we'll talk about it later, but from in situ, in the tissue that it originated in, into the connective tissue that's supporting it. The They really dissolve the matrix of the connective tissue, which is extracellular and non-living, and so it doesn't actually cause an inflammatory response. So the tumor just grows into that space. Now, uh, it doesn't take very long when the tumor starts to be growing at this rate, that with all these blood vessels, that the tumor cells start to actually invade the blood vessels, and they start to migrate because they travel in the blood. Um, I'm just looking here to. So there's thousands of these cells break away and move out of the tumor, migrate out of the tumor, but most of them actually um, don't live. They get taken out by the immune system. They don't find the right uh, place to colonize. Um, so it kind of depends on the cancer and where they have predilection to go to. On page 172 in the textbook, there's an interesting talk about this, where they call it seed versus soil theory of metastasis. Some of these migrating cells, some of these cells that are passed in the blood, um, they're really the seeds of new cancer. They Where they end up if it's amenable to that specific cancer, then there seems to be where they take root, and that would be a product of the soil. Um, Sort of like what they're showing is that um, that certain cancers favor uh, certain sites of metastasis over other sites. Like prostate seems to go to bone um, more favorably than other tissues. So it used to be that we would treat trying to prevent the migration. We would treat trying to prevent the seeding of these things, but it's almost an impossible task because there's thousands of cells shed into the bloodstream every day. Uh, Almost impossible to get hold of. The new treatments are now looking at making other tissues inhospitable to the to colonization, to the the cells actually taking root. Uh, if they do start to colonize, that basically what happens is it starts this whole process over again. So the colonized, the uh, metastasis cells end up um, proliferating and then turning into a full-grown tumor, and then there's angiogenesis, so they get blood vessels, and then they invade the local tissue, and then they set off to to migrate, and that's how the cancer spreads throughout the whole body. It says here on page 172 that 30% of clients with newly diagnosed cancers have clinically detectable metastasis. At least 40% of the remaining clients who are clinically free of metastasis harbor occult or hidden metastasis. Um, so it's this is when things become malignant and become really very bad. So what causes this to happen? So um, it's this oncogene. Uh, there is various theories. The internal factors are an inhibition of apoptosis, the programmed cell death. If a cell lives beyond its programmed death, then there's likely to be mistakes in it. It's I Yeah. Um, so these would be the endogenous factors. Um, there's inherited factors. A lot of cancers seem to run in families, like, for instance, bowel cancer, breast cancer. There seems to be a genetic basis to it. Hormonal activity may actually increase. So, incidence of certain sort of like breast cancers um, might depend on the presence or the absence of certain hormones like estrogen. Uh, Other cancers arise when the immune system is deficient, like, for instance, Kaposi sarcoma in the case of HIV. People that are on immunosuppressive drugs for transplants have like a 30 times greater incidence of skin cancer than normal people. Uh, so all of these things probably work together. So uh, if you have inherited factors like breast cancer runs in your family, and you have uh, high estrogen counts, and you're immunosuppressed, then you're worse off than if you don't have those things. There's all kinds of external, exogenous factors. Most of them we call carcinogens. And carcinogens can be uh, various hydrocarbons. It can be all kinds of different things, dyes, gases, um, nickel, cadmium, asbestos. all kinds of things like that. There's all kinds uh, of of different things, and they say that 50% of all cancers are caused by one or more of these cancer-causing agents. So, yeah, some drugs for other things are carcinogenic. So, it's usually a combination of these internal and external, these intrinsic and extrinsic factors that come to fruition. It might be carcinogens in combination. Is it like uh, people that smoke and are exposed to solvents because they spray paint cars and you know, have asbestos in their insulation are more prone? I don't know. It's very hard to know these things because it, it's very hard to determine what is the cause and what's the effect. Um, Lots of people see that there are problems, cancer problems that are linked to viral infections. Hepatitis is a big one for liver cancer. HPV for cervical cancer. There is herpes, HIV. Those sorts of things all become part of it. Um, Stomach cancer can be caused by H. pylori. This Borrelia burgdorferi is Lyme disease. Uh, you know, parasites, Schistomonas, can cause bladder cancer. Things like that. All of these things, what they do is they spark up the immune system and they cause you know, problems with coping, and that may just lead to this oncogene activation. It may lead to dysplasia. Uh, there's various other things too, like aging. You don't think of it, but aging is a risk factor. Once you get more than 50 years of age, your risk for developing cancer is much higher than when you're lower in age. 70-year-olds have a really high risk of it. Use of tobacco, diet, nutrition, especially things like um, preservatives and things like that. Use of alcohol. Sexual behavior can do it. HIV and but even things like just STDs. Uh, Stress, it seems to be able to do it because stress is an immunoinhibitor, and do these dysplastic cells slip under the radar the of normal natural killer cells when you're immunosuppressed because you're stressed. It, it probably is all of the above. Um, so, what are the signs and symptoms, the clinical manifestations? Really, it depends. One thing that you can say is that if there's lots of signs and symptoms, then you tend to catch the cancer early, and the prognosis is actually better. The ones that are silent, the ones that don't give very much signs and symptoms, are the ones that might be well advanced and metastasized before it's caught. The the rate of growth is a big factor in the signs and symptoms. But there could be all kinds of things, changes in bowel, lesions that reoccur in the same spot, lumps, you know, indigestion or difficulty swallowing might just be that, like, there's a tumor that's taking up space, and you just can't get the food down the esophagus past it. changes in warts and or moles might indicate skin cancer. Persistent cough. The tumors, especially if they're growing quickly, rob you um, of nutrients, and so you lose weight quickly. You're fatigued. You may have anemia. Fever is often, but who pays attention to a fever? Fever is in so many different things. Yeah, it's all kinds of different things. Uh, Pain is often a big problem, especially because the tumor takes up space. Uh, Pain and fatigue are probably two of the big, and weight loss. Um, there's an idea of something called paraneoplastic syndromes, and really what happens is that the tumor starts to think it's something else, and maybe produces, um, especially if it's a carcinoma, hormones, and start to mimic part of the endocrine system. Uh, they don't really know what's going on, but you can imagine that if, say, you have a tumor in your lungs and it starts to think it's adrenal cortex and starts pumping out cortisol, you're going to have all the signs and symptoms of hypercortisolism. You're going to have Cushing's syndrome, which is like a diabetes uh, in terms of blood sugar. It yeah, it can be quite nasty. Or what would happen if the tumor started pumping out aldosterone uh, unremittingly? Then you're going to end up in sodium imbalances. Um, any one of a bunch of things. It might be thyroid, or you know, and so these paraneoplastic syndromes can be um, quite nasty. So um, so the trick is if you can't prevent it, uh, then to catch it early before it's metastasized, before it's become a secondary. Uh, so so what do we do to prevent primary things? We screen at-risk people. You know, PSA tests for prostate uh, cancer, colorectal exams for colon cancer if it runs in the family. We identify the high-risk people and we screen them, breast cancer screening, things like that, to try and catch it. And we might they're trying to develop drugs to help with those. So if they do find it, then we move into kind of a secondary prevention where we're trying to prevent morbidity and mortality issues, where you try and actually intervene. Uh, you know, the um, stop the metastasis, that kind of thing. Uh, and then the tertiary preventative is really managing symptoms, and it's usually a little bit late by the time you're doing that. But really, so these screening tests, the self-examination, the various tests, blood tests especially, imaging, radiography, just screening tests. Biopsy of suspicious changes. That's actually falling out of favor now. They're not doing as many biopsies as they did. But once it's diagnosed, once you see something, then they have to figure out where it's at. And this is where staging comes in. So really, there's there's a couple of different ways that this is dealt with. Uh, one one of them is this stages 0 through 4. Or the tumors, nodes, and metastasis system. Those are kind of the two different types of systems. Um, so if it's a tumor, then they rate it as TX. The tumor can't be evaluated. We know it's there, but T0 is no evidence of the primary tumor. TIS is in situ. That means the tumor is there, but it hasn't spread. It hasn't started to invade local tissues, right? And then T1, 2, 3, and 4 really look at the spread of that. They also look at the spread because most of it's spread through lymph nodes. They look at the lymph nodes when they do breast cancer. They look at the sentinel nodes. So if there's no node involvement, it's NX. So or if they didn't evaluate it, N0 is no nodes, and then N's 1, 2, and 3 look at how many regional lymph nodes get invaded. Metastasis is really no metastasis and metastasis found, or it could be just not evaluated. But so really, what would happen is somebody would maybe be a TIS N0 M0, which would mean that it's caught early, that there's a tumor, but it's in situ. There is no lymph node involvement, and it hasn't spread by metastasis. Obviously, if you go up that thing and you're a T4 N3 M1, things have spread quite a bit. I don't hear of this this grading system as much as the grade 0 through 4 system, which is this one. So stage 0 is cancer in situ. So the cancer is there, there's a tumor, but the cells are still in the original tissue, the tissue that it came from. So like a skin cancer in situ would still be in the epidermis. If it's a basal cell carcinoma, it will still be in the epidermis. If we look at the next stages, stages 1, 2, and 3, we're looking at spread into the tissues and in adjacent tissues. So a stage 1 is small size, maybe no nodal involvement, starting to invade into the other tissues. So it would be things like an early stage localized cancer. The stage 2 is an increased risk of spread because now the tumor is in this angiogenesis, that it's a bigger tumor, there's blood vessels in it, and so there's more more chance of spread. In stage 3, it's still a local cancer. But it's gone into other tissues, probably into the dermis of the skin or into the other surrounding tissues, and it's a fairly sizable tumor. And stage 4 is when there's metastasis. It's gone to another organ, so it's at some distant site. So that's that's basically how we look at this staging system. Uh, the grading system is looking at what's actually happening with uh, with the cells. It's looking at the degree of differentiation or the lack of differentiation. Uh, so so a grade 1 is the cells look like what they were supposed to. They might be slightly dysplastic. So when when they do a pap smear and they say, "Oh, we see some abnormal cells," they're probably at this G1 stage. G2 are moderately differentiated. G3, uh, the cells start to become really very poorly differentiated. You can probably tell where they came from, uh, but they don't resemble the original cells very much anymore. And then the G4, as the cells are completely undifferentiated, they're just a mess. Um, so once they decide kind of what stage and grade uh, the tumor's at, then it becomes the idea of treatment. If this thing is in situ, or even a grade 1, perhaps even a grade 2, then surgical excision is probably your best bet. Just cut the damn thing out. Or burn it out using radiation therapy. Right? Stop the growth of it using hormones. They freeze it off with liquid nitrogen if it's on the surface, especially if it's a little in situ pre-malignant sort of thing. I just a couple of weeks ago had a spot burned off my left clavicle, and he wasn't certain if it was in situ or not. He just said, "Well, it's is it a pre-malignant or is it the beginning of a malignancy? Either way, let's just get rid of the damn thing." And he just zapped it. One of the targets, because the tumor cells, especially these undifferentiated tumor cells, are very highly mitotic. They're in mitosis a lot. The chemotherapy and the radiation therapy target those cells that are in mitosis. The chromosomes, it breaks up the chromosomes of those cells and kills those cells. Unfortunately, that accounts for the side effects of these things. Hair follicle cells are very highly mitotic, and that becomes an issue because you're not just killing the tumor cells, you're killing any cells that are in mitosis. So skin cells, hair follicle cells, those sorts of things tend to die as well, and that's why your hair falls out. That's why you get ulcerations on the skin. The skin is poorly healing. The mucosa of the digestive system is very highly, so that's why you get nausea and problems with digestion. All those things are because chemotherapy and radiation both target these cells that are in mitosis. And presumably the majority of the tumor cell is in mitosis, where the majority of your other tissues isn't in mitosis. I'm not certain what that's about, just I guess the edema. So how do you prevent it? Get rid of all of the lifestyle things that are maybe contributing to it. Eat better, exercise, control weight, use lots of sunscreen, practice safe sex, stop smoking, use early cancer screening methods. All of these things are really directed at lifestyle changes that help prevent things. So it is inappropriate to especially to rub on a tumor. You can imagine that it may increase the seeding, increase the colonization. Um, you want to be very careful around it. But you can help with pain and anxiety, maybe not so much nausea, fatigue, and depression. Um, so be gentle with these people. Right? These One of the other problems is that all of these other things that can happen, including deep vein thrombosis, uh, bone can get eaten away and become very brittle. So if the tumor is metastasized to ribs, you probably don't want to be putting a lot of pressure on ribs, you know, and that kind of thing. So that's a quick overview of cancer.